Ryan Leaf is a gentleman who dealt with extreme disappointment in his life, a lot of challenges. His career didn't work out, and not only did it not work out, it didn't work out spectacularly on a national stage. He suffered with addiction and has overcome that and got into recovery. He's got a very compelling story to tell. Our panelists are from the local community. They're very involved in recovery efforts. They serve on the opiate task force, the mental health task force. They work in their fields to help with the health of the community.
So there's still a huge stigma with addiction and mental illness. So when you have events like this, you're bringing everybody from the community to help reduce that stigma. And you're also giving them somebody who went through exactly what they went through and came out the other side successful, showing them that it is possible and you can succeed well. You don't just have to live a basic life. You put everything in order and you get your life going. And then when you have the community here supporting individuals in recovery, it helps reduce that stigma. It helps them re-enter in a loving fashion.
You have to have that support. You have to have those people around you that you can share your problems with. I mean, one of the things when you think about an alcoholic drug addict, they're isolators. We like to isolate ourselves and go into our own little world. And without people around us, without that environment of recovery around us and people to share it with, it simply doesn't work. One of my favorite lines is, "Thank goodness we're not all sick at the same time."
This is purposeful because I know how I felt, and it was miserable. And I don't want anybody ever to feel that way, and I want them to know that there's solutions. And there's communities in this country so far that are taking a stand, are making an effort. Indiana has been exceptional. Ironically enough, in Peyton Manning country, I've been back to Indiana and spoke 8 times so far in the last 3 years. So that tells you what this state, this community, and everywhere else in Indiana are trying to make positive changes to be part of the solution.
You know, I quickly learned when I was running for office how important mental health and substance use disorder particularly impact not only our communities but our entire state. It really impacts everything from our children, Department of Child Services, education, to jails and prisons. It's just such an enormous problem that impacts so many levels of our state. It's really such an important issue.
Hey, I was on the panel to speak, but it turns out I was here because I needed to hear Ryan Leaf's message. I was very moved by it. It had a major impact on me. In fact, I hope he can speak to other judges around the state. We need to hear people's stories on what has been successful, what has not. How are we treating people? How are we talking to them? What are the words that we're using? But it was a very powerful message and really one of hope that really anybody can change. So feel fortunate to be here today.
Well, I think it's good because it gets the community on the same page. You know, you see people in that room that are from the judicial system, from the treatment side of things, from probation. You have politicians, you have mayors, you have a lot of people that deliver care in the community. And so I think it's good for everybody to get on the same page in terms of identifying a problem and then coordinating how it will be addressed.
To understand, the overprescribing of pain medications and the other mitigating factors that come into play when someone ends up down the path of addiction. It's a really hard thing to wrap your head around, and it's a lot of work to be done, but it's events like this that can keep us inching forward in a positive direction.
There are so many different groups, organizations, commissions, committees, courts, parts of government, sub-governments that realize these problems are out there and want to do their best to try to address them in their own way, but there's not really a whole lot of let's get these together in one silo and get everybody to meet each other. Again, that's another reason why these types of events are so good, because you start making those connections. It's like, well, if you're doing that, we're doing something really similar. How about we do it together and make it better?
So Meridian helps set them up for success from the very beginning, especially if they enter inpatient. They start learning the skills to cope with their addiction, to learn about their addiction, and to be able to move on from their addiction. And then they would come to somewhere like the Home with Hope, which is a recovery home, sober living, and we help them start getting those grounded basics again. They are surrounded by people who are clean, safe, and sober, and that is a huge part of their success.
Mental health is not unique to any community. And I'm not sure of another time, at least in my time in law enforcement, where people are starting to understand mental health, and there's not such a stigma that is associated with it. So when we have people like Mr. Leaf who can come and tell his story, I think that empowers other people that may also be suffering from a mental health issue to reach out and get those resources and also share their story in hopes that that leads to a path of recovery.
So we're fortunate in our community to have law enforcement that are trained to recognize mental illness and then make sure the person is going to the appropriate facility, getting the help that they need. Oftentimes it's bringing them to a hospital, not bringing them to jail.
Meridian Health Services has been a fantastic partner, working with our social service worker, making sure that they can provide the resources that we need. Meridian Health has really played a big role in what we are trying to do and has helped us be successful thus far.
Meridian has an amazing intensive outpatient therapy program that we use, as well as a recovery coach that works closely with our individuals in addition to individual therapy. So it's multifaceted, if you look at it that way, of the services that can kind of wrap around. It's kind of like a wraparound program for our people that are involved, and that's not something that we see with any other agency in our community, and I feel like that's why we have such a good working relationship with them. There's open lines of communication where I'm speaking with the recovery coach, or I'm speaking with the therapist daily about my cases and where do we need to be, where are they, what can we do to help them.
There has to be real life around a person in recovery, because once they get out, there's going to be real life, no matter what. Somebody said, well, you can't have liquor in your house. Well, guess what? There's liquor right outside my door. There's drugs right outside my door. Everything is outside my door. I have to understand that this is a real world that I'm going to have to go into.
Meridian has a pretty wide range of programs, everything from we do the physical, mental, and social health.
I think it's good for people to get a chance to know what resources are available in the community and an opportunity to look at how we can work together to address substance use and mental health in the community. Pulling together as providers, really wrapping around clients and individuals. I just kind of look at it as like we're a network, and so when that individual goes into the community looking for a resource, every person should be able to guide them along the way in their recovery. So we help that individual get into those services. Meridian provides the services that they do, and then when they transition back, we're working with Meridian to make sure they're continuing their appointments, they're getting the transportation to their appointments, and really continuing that care.
I think it's important to bring awareness. I think, especially in the middle of a worldwide pandemic, a lot of things get lost, and a lot of things fall to the wayside. And as we've totally became focused on one very important aspect of the community, COVID-19. Addiction and the throes of the opioid crisis have continued to rage on, and having events like this remind us that as we've soldiered on in a very important pandemic, we still have battled crises in addiction.
Well, especially today, we have so many issues that are going on in all of our communities, and they're related in how our children are raised, and with drugs, and with all kinds of different things that come into one's life that is a challenge. I see what we're doing here with Meridian across the state is bringing people together with different kinds of issues, and they're working together in their communities, but they also have the opportunity to see what's going on in other communities. So I think as an organization, we've been able to bring a lot of people together that would not have been together otherwise, and that means we make progress.
I mean, the truth about addiction is it's multifaceted. So there are issues, socioeconomic issues, there are a lot of times there's psychiatric illness, there are medical issues, and then there's the issues of getting prenatal care, which oftentimes these women were not getting. And I think that was the main motivation behind getting with Meridian and establishing the maternal treatment program. It basically offers women all the support that they need to achieve the life that they want and to be the mothers that they want to be, and it's all in one facility. So basically we're just giving hope to women who want to change their lives.
Well, our community mental health centers and Meridian in particular are so important in being not just conveners, but also that safety net that's really helping ensure that we're providing behavioral health specialists at our recovery courts, ensuring that all of the pieces are coming together. And that's where organizations like Meridian are so important, is that you have the resources and the tools and most importantly the people that can help fill these roles as we begin to build a system that doesn't just look at how do we move people into treatment, but most importantly, how do we sustain people in recovery.
And all the services that we provide, there's a component of prevention, but also being reactive and proactive with what we can do with the services. So, Meridian's just ongoing all the time and always thinking about what we can do more, and that's what we do.
What brought me and what drew me to Meridian was just how they work within their communities around all problem spots. I remember a few years ago back in Muncie, they talked about the program they did with mothers who are going through withdrawal and through the process, through the hospitals and everything like that, to get them back and not have children born into addiction. And I thought that was just magical, because people are afraid to do things like that sometimes because it's controversial or whatnot, and there's a lot of judgment around it. And the more we can remove the judgment, the stigma around addiction and mental health, the better chance these individuals have.
The opiate epidemic that we talked about 2, 3, 4 years ago has never gone away. It was bumped off of people's awareness, off the front page, off of the news shows by COVID, and very appropriately so. But during this time, addiction problems have escalated, if anything. The more awareness we can bring to the community about the problem, about addiction, about the resources that are there to help people get into recovery, and to bring the community together to support those efforts, I think is very important. And this is just one piece of that puzzle, one thing that we can do to help bring that to the community, and we're proud to do it.